Hello, everyone, and welcome. Thank you for joining us for today's webinar, Navigating Ethical Choices in the Care of Older Adults, presented by Home Instead and hosted by the American Society on Aging. We will begin shortly, but before we do, we have a few housekeeping notes. I would like to direct you to the 5 tabs on your screen labeled Speaker Bio, Important Information on Group Viewing, CE Application Here, FAQ Troubleshoot, and Event Resources. The slides for today's presentation are available for download under the tab labeled Event Resources. You will find information on how to obtain CE credits for this event under the CE Application Here tab, including links to the application and to the step-by-step CE guidance webpage. Please take time to review the CE guide before submitting an application. We do not email certificates, and this guide includes all the information that you need to not only submit your application, but to also instantly download your certificate. You will be able to access the CE application for a minimum of 2 hours after viewing the webinar once attendance data from the webinar platform syncs with the CE application platform, although it may take a bit longer. We appreciate your patience. Please be aware that your time is logged and you must view the entire hour-long webinar to be eligible for CE credit and to access the application. If you are not logged into the webinar directly using the email address that you registered with, then you will not be eligible for CE credit as we have no way of tracking your online attendance. Anyone who is registered before the live webinar, you will also receive a follow-up email by the end of the business day that will direct you on how to claim CEs and include links to today's slides and recording. Otherwise, you will find all the links and information in the tabs on your screen mentioned earlier. You have 60 days from the live date to complete a continuing education application. If you have any questions during today's webinar, you can send those to us at any time using the Ask a Question box, and we will do our best to get to those questions in the last few minutes of today's program. And now I would like to welcome our presenter, Dr. Lakeland Eichenberger, a gerontologist and caregiving advocate for Home Instead and Honor Company, the world's largest provider for home care. With a doctorate in gerontology from the University of Nebraska, she educates professionals, families, and communities on the challenges faced by older adults and available resources to help them thrive. Lakeland is a sought-after speaker on caregiving, contributing nationally and internationally, and serving as a media resource. Lakeland, we are so glad to have you here today.
Thank you so much, Julia. Hi, everyone. Welcome to today's webinar. Thank you so much for joining me. As professionals in the aging sector, it's really important for us to recognize that ethical issues can arise, and they do arise when we work with older adults. And we see ethical issues in multiple areas, including complex family dynamics, addressing end-of-life wishes, preserving dignity and respect, promoting independence while also keeping the individual safe. Those are just a few of the many ethical issues that we might face. And there are various factors that can make older adults vulnerable to things like abuse, neglect, and ill intent. However, there are ethical principles that can guide us as we handle these ethical issues. And by better understanding these ethical issues, we can help to reduce the risk of harm, we can advocate for older adults, and then also report issues to the proper authorities when necessary. So again, very excited to have you joining me today. And here are our objectives for this presentation. So I'm going to start by reviewing the ethical principles of caregiving. And these principles really do apply to any profession, but we are going to look at them through the lens of working with older adults. I'm also going to talk about common ethical issues and discuss the prevention of neglect and abuse. Sadly, this is a common ethical issue that we face, but it's not the only one. I think abuse and neglect gets a lot of attention because, again, it is common, but there are other ethical considerations that I want to bring up today that go beyond just abuse and neglect. I'm also going to talk about how to support an older adult in decision-making, especially keeping in mind their independence and their dignity, and then finally going to walk us all through an ethical decision making model and then offer up some tips and resources. So let's talk about ethics. So when we work with older adults, it's really important that we treat them with dignity and respect. Acting ethically honors rights and dignities of other people. So when we formally define it, ethics is a system of moral values or a set of principles of conscientious conduct. It's doing the right thing and honoring someone's decisions. Most of the time, it's easy to do the right thing, but you may have issues that arise that create challenging situations. Many professions, such as healthcare, often have a code of ethics, and many of us in other types of professions that relate to older adults, again, you might have a code of ethics. And it's something that's often drilled into us when we go through our training, but family caregivers may struggle with ethical decision making when it comes to the care of their aging loved ones. And so many of us interact with family caregivers in our day-to-day jobs, and so I'm really glad that you're here to learn more about this topic, and hopefully we can share some of these insights with these family caregivers that we work with. We know that there are some certain attributes that make older adults more vulnerable, and again, that might also be something that family caregivers, they don't necessarily recognize, and they don't understand maybe how it could impact their decision making when it comes to the care they're providing for an older adult. So it's great, again, that you're here, and we can help guide family caregivers or point them to resources to help them navigate these challenges. But when we talk about the topic of ethics, really what it boils down to is doing the right thing. And again, sometimes it's easy to do the right thing, sometimes it's really tough to do the right thing. And before we dive too much deeper, I would love for you to use the question function of this webinar and tell me, what are some of the ethical issues that you are facing in your day-to-day jobs? And who knows, I might be tackling some of these in the webinar, and if not, then maybe we'll have a chance to talk about them towards the end of today's presentation. And at the very least, it will help me add more depth and richness to this presentation for the next time that I do it. So again, if you're listening and want to share an ethical dilemma that you're faced with, feel free to do that in the questions section of this webinar, and we'll again try to tackle some of those at the end. So as I mentioned, ethics is doing the right thing, and there are some laws in place that help to guide us on kind of this ethical journey of working with older adults. So part of the Patient Protection and Affordable Care Act in 2010, there was the Elder Justice Act, and this was the first piece of federal legislation passed to authorize a specific source of federal funding to address elder abuse, neglect, and exploitation, which again is one of those important ethical considerations when we're working with older adults. And this act was the first comprehensive legislation to address elder abuse. And again, it authorizes funding for state and local adult protective service programs. And I'm wondering if maybe there are some folks on the call today that work within these adult protective service programs. Thank you for all that you do. I know it's not an easy job. This Elder Justice Act also provides additional support for the Long-Term Care Ombudsman Program. Also, if there are some ombudsmans on our call today, thank you also for the work that you do. These programs work to resolve problems related to health, safety, welfare, and the rights of individuals who live in long-term care facilities, such as nursing homes, assisted living facilities, and other residential care communities. So these ombudsman's programs promote policies and consumer protections to improve the long-term services and supports at the facility on the local, state, and national level. And while these laws are really important, I do want to make this distinction between law and ethics. The law is the minimum that we should do to protect older adults, and ethics should be the maximum. An ethical person follows the law, but is also guided by a higher principle. So an ethical person does the noble and right thing and bases their actions and decision-making on values. So, laws the minimum, ethics are the maximum. So, hopefully, today we can help you really understand these ethical principles and how you can apply them to your day to day jobs. So, again, it is important for us when we're working with older adults to really understand those attributes of older adults and aging that make this population more vulnerable. One of the reasons I love working with this population is it's such a diverse group. Older adults, I love sitting down and learning about their history. There are, everyone is very individual, but we do see some kind of trends and overarching attributes that can increase a person's vulnerability as they age. So, again, it's important for us to understand these and also to educate family caregivers about them because they might not understand why these attributes might make their aging loved one or the person that they're caring for more vulnerable. There's many of them here listed on the slide. There's isolation and loneliness. We know that this can lead to physical and mental health issues that can make a person more vulnerable. We know health status and physical decline can also limit a person's mobility and activity and may increase their need for care and support, may increase their need to rely on another person, making them potentially more vulnerable. We also know personal losses, loss of a spouse or friend, even the loss of independence, like having to give up the keys, a loss of purpose. Maybe some people experience that in retirement. These can be considered as personal losses, and they can make a person more vulnerable. Also, cognitive impairment. We'll talk more about Alzheimer's and dementia a little later on. Some of these early signs of cognitive impairment can be things like poor judgment, which can leave a person vulnerable. And also, as the disease progresses, again, they need to rely on others for care and support of their physical needs. And again, that can make them more vulnerable. We know that financial and socioeconomic status can lead to vulnerability, especially when someone lacks those resources. They might become more vulnerable. And we know that those that live in poverty often have a lack of access to services and supports. There might be things in their environment that impact their vulnerability. If the care environment, maybe it's a care community, assisted living, nursing home, and while there's, again, often great policies and procedures in place, it can also at times lead to vulnerabilities. And so we need to keep all of these things in mind, in addition to the fact that older adults are often less likely to report abuse. And so they might do this for several reasons. It might be that they're dependent on their abuser, that it's the family caregiver perhaps, and they're afraid if they report it, then who is going to care for them? They may also be embarrassed to report the abuse because there's a sense of shame associated with it, or they might not even recognize that abuse is happening. And this might be in a situation perhaps when an individual has cognitive impairment. So these vulnerable attributes of advanced age makes ethics that much more important. So let's now dive into those ethical principles that really should be kind of our guiding light through this conversation. But before I go through these definitions, it's important to note that the terminology around ethics can vary from profession to profession. And the terms don't matter as much as the meaning behind the terms. And that is what really should guide us as we work with older adults. So these ethical principles that are shown here on the slide were first introduced by Buchanan and Childress in the 70s, and they're really at the core of ethical reasoning. And these were created kind of specific to healthcare, but again can be applied to various professions. So we have autonomy, justice, beneficence, and non-maleficence. And then in the 80s, Kitchener added a fifth principle for the field of counseling, which is fidelity. I think that that last one can apply to family caregivers. And so let's talk through each of these principles now. So autonomy, not anatomy. Oh my goodness, I need another cup of coffee this morning. Oh my, I did it again. Autonomy, pardon me, is the principle that addresses respect for independence and self-determination. Really, the essence of this principle is allowing the individual the freedom of choice and action. And isn't that what we all want? The ability to make our own choices and to act in the way that we want to act. But we know that as we age, we might start to feel like our autonomy is being compromised. We'll talk more about that. Next is justice. This seeks the sharing of benefits and burdens based on fairness and equality. And sometimes um, older adults might feel like there is an injustice in the way that they're being treated. And so we need to be mindful of that. Beneficence, simply stated, is means to do good, to be proactive, and also to prevent harm when possible. And when I think about this in the work that we all do, um, in terms of health and well-being, there are some kind of proactive steps that we can take to help make sure that we are doing good in preventing harm. Then there's non-maleficence, and this is the concept of not causing harm to others. Often it's explained as, above all, do no harm. And then there's that fidelity, and again, this depends on your profession whether or not this applies, but I think, again, for family caregivers, this is important because it involves notions of loyalty, faithfulness, honoring of commitments. And when I talk with family caregivers, they often use those terms. Well, my mom raised me, and so I'm loyal to her. I want to provide her care. Or I promised my mom I would never put her in a nursing home. I want to honor that commitment. But at times we know that maybe keeping that person at home is going against the ability to do no harm. Because that person maybe needs care needs that go beyond what can be provided in the home. So these, again, are some ethical considerations, ethical principles that will guide us. And when any of these principles are overlooked, a person might be at risk for abuse or neglect, those kinds of things. And there is several ways of driving these ethical principles. They're often embedded in our professions, in our organizations, in our culture, and they can be broken down into categories of formal and informal. So these formal dimensions of culture that can drive kind of these ethical principles would be things like policies, codes of ethics, value statements, rules, regulations, Bill of Rights, those kinds of things. And it also involves the process of how to report or how to care for a patient. And those that have a license or certification, it could also involve some sort of ethical review board or standard reviews, quality assurance reviews, those kinds of things. So these formal dimensions, they're often written down, they're planned out, there's a process that goes along with it. There is a formality to it. But then there's also these informal dimensions of culture that can drive our ethical principles. And these are the norms of how people actually do things. It's the stories that are told, the observed behaviors. You could also consider the influence through kind of those water cooler conversations as a informal dimension of culture. I don't know if you've ever in your job heard somebody say something similar to this. Well, the handbook says X, but how we really do it around here is Y. And so, again, there might be that formal dimension of culture, but there's an informal influence that kind of takes precedent. And so I think it's just really important to be aware of the two. So again, the formal is that written down, planned out, and that informal is more of those unwritten dimensions of culture, the more spontaneous, the more kind of observed behavioral kinds of things. So you might think about your own workplace and those formal and informal dimensions of culture. I had mentioned the Bill of Rights, and I just wanted to share an example of this. just to help us understand what kind of that more formal dimension of culture can look like. Um, we know that a lot of places have bills of rights, hospital systems, senior living communities, often any sort of care that comes into the home, whether it's home care, hospice. And so these, again, are those kind of written down rules, um, written down statements that give the individual certain rights, preserves their dignity, respect. And when these are broken, then we might have some cause for concern from an ethical perspective. So I won't go through this word for word. This is kind of, again, just an example of a Bill of Rights, and I'm sure your organization has um, something very similar in your policies or procedures in terms of protecting the rights of those that you serve.
Lakeland, I'm sorry to interrupt you, but can you just
Oh,
speak a little bit louder, please?
yes, I'm so sorry, everyone. All right. Hopefully, you can hear me better now. Okay, so we're going to talk through some of these common ethical issues, and I'm looking at the chat, and I'm seeing some of these popping up in your comments on what you are all dealing with on a day-to-day basis in your professions. And I want to thank you so much for sharing those. It's almost like we were all in sync. So a lot of these are captured here on this slide. I'm going to dive deeper into some of these specifically, um, but some of them I won't have time to dive into. So really, if you take a kind of holistic look at this, a lot of it kind of boils down to the ethical principle of autonomy, being able to make decisions about their own care. A lot of times we take advantage of our autonomy, the right to make our own decisions, and we don't realize how that might be impacting an older adult if they're feeling that their autonomy is being taken from them. An older adult might still want the ability to vote, to open their own mail. They might want to keep their medical records private. They want a say in their diagnosis or plan of care. They want to participate in decision making and have control over where they live and the kind of care that they have. Um, and so these are things that we need to keep in the back of our minds. We need to involve the older adult as much as we can. So I mentioned I'm going to cover some of these in more detail, a few that I can't get to quite in as much detail today. One of them is ageism. So I wanted to just touch on that really quick here. We see this in a variety of environments. And sometimes it can manifest in things like medical care, where an older adult, for example, there might be a less aggressive treatment based just on someone's age or a belief that an older adult cannot handle something of that sort. So, this might lead to kind of poor outcomes for that older adult, and it might go against some of their wishes. So we see ageism, crop up in all sorts of places, but again, that's just one example. Another topic that I won't have time to dive too deep into today is bias and discrimination. We know that that can impact decision making or ethical situations in decision making. There might be discrimination based on race, sexual orientation, gender, and it might lend itself to situations where an older adult isn't getting the services or supports that they need because of this bias and discrimination that is happening. We also know personal privacy can be an ethical issue, especially for those living in a community setting, and one in which professionals are coming in and out of their room or apartment throughout the day, sometimes without knocking. In these instances, it can be helpful to really put ourselves in the shoes of the older adult and ask, how would I want to be approached in terms of my personal privacy? And that can be one way to give us some perspective. And then one last one I want to touch on here before moving on is grievances or complaints. I mentioned earlier how older adults sometimes are hesitant to express complaints because they do not want to be treated differently, and that's really really sad that we even have to be talking about that, because an older adult, again, has the right to express, or should have the right to express, grievances without fear of retribution. And that's, I think, where these ombudsman programs can be so important. I know at Home Instead, our organization, we have a corporate ombudsman team that helps process, um, that has a process in place to ensure that older adults and our care professionals' voices are heard. I know same types of things exist again within community settings. There's often ombudsmen within nursing homes or long term care communities. And so we want to be able to provide a safe space for older adults to air their grievances or complaints. So, one of these topics on here that I'm going to dive into next is competency and capacity. And often there's confusion between these two terms, and I have to admit, sometimes I still get a little confused, but it is important to understand because it involves a person's ability to make decisions and have an influence on how they're cared for, and a lot of components that come up in ethical situations. So, capacity is the ability to make decisions. It's really a fluid concept. An individual might have capacity in one moment and then lack it in another. Competency is the ability to perform actions needed to put a decision into effect. Often this is a legal term, and the opposite is incompetency, which is the lack of ability to understand things like healthcare or financial management decisions. Again, it can be a little confusing, but it is very specific to the situation a lot of times. Sometimes people assume it's an all or nothing type of ability. Either you have it or you don't. But, um, you know, really it's more complex than that. So it's important to understand that capacity is decision specific. And this means that a person's capacity should really be evaluated in light of a specific decision to be made, and it can fluctuate based on the circumstance. So generally, capacity requires a person to understand, one, the situation that they're in, two, the decision that's in question, and three, the consequences of making a given choice. So, an example of this, immediately after a person comes out of surgery, they're coming out of the anesthesia, they're really groggy, and in this state, they might lack the capacity to address anything more than a very simple decision. But once that fog lifts and they are recovering, their decisional capacity could improve. Um, and after that surgery, they might then lack the ability to make those important decisions. One area where this comes up a lot in the work that we do, and I saw in the chat that you guys you commented on this, is dementia, Alzheimer's, cognitive impairment. It's really hard to know, okay, does the person have the capacity, the competency to make decisions or contribute to their care plan or whatever decision is at hand. That's why it's so important in the situations where a person has a diagnosis or exhibiting signs and symptoms that the family starts planning as soon as possible for things like care decisions, health care, so that the person can contribute to the decisions being made, or at least voice their wishes, so that down the road, when maybe they no longer have the capacity or competency, that their wishes have been heard. And so, again, that is an area where things become really tough, and sometimes you have to get a legal professional involved or healthcare provider involved to assess a person's ability to make certain decisions. And then the final part of this is informed consent, and we know that this involves adequately informing an individual about treatment or services, and we know that in order to provide consent, you do have to have the capacity to do that. So sometimes that comes up when we talk about this particular topic. Another one that comes up quite often is the ethical principle of, one that comes up a lot of times around this autonomy is confidentiality. We know that many professions have an obligation to keep confidentiality, and we know that there are laws in place such as HIPAA and regulatory guidelines, and we see ethical issues arise sometimes when it comes to this. Maybe an adult child wants to have the information about their parents' health care, but they do not have healthcare power of attorney. And so that kind of gets a sticky situation. Um, and we know that it's really important for all of our professions from an ethical standpoint that we follow this HIPAA personal health information and regulatory guidelines. But sometimes it is necessary to break confidentiality to report things such as abuse or impaired decision making capacity. And again, we all probably could share examples of when this might be appropriate. Again, because many of us are mandatory reporters in our various professions. And something else to think about is it's important to maintain professional relationships as part of the work that we do. It can be so easy to form relationships and really get to know and care for those that we work with. And that's good. I think developing relationships with those that we care for is a really good thing, but we need to remain professional and not let that get to a place where it becomes an ethical dilemma. All right, so the next topic we're going to touch on is elder abuse. And I do not, again, want to downplay this topic. It is extremely, extremely important. But I do think that, again, it gets a lot more attention than some of these other ethical issues. So on the slide, I'll let you all read about, physical abuse, sexual abuse, emotional and psychological abuse, financial abuse, and neglect. I think these are all terms that we often hear about. We often see this, not hopefully we don't see it often, but when we do see this, we have often, been educated on these various types of abuse and neglect. But I think one thing that we don't really talk about is how this relates to caregiving. And caregivers, this might sound a little controversial, and again, I'm not condoning abuse and neglect in any way. But if you think about caregivers, oftentimes they're so overwhelmed and they reach a point of burnout, of frustration. And in those moments, hopefully we as professionals have equipped them with supports and resources to help them navigate that. But for some, they might I don't want to say accidentally, but their actions might result in a form of abuse and neglect. And they didn't necessarily intend to, but they have gotten to this point of such burnout and distress and getting to a point where they just don't know what to do next that this might end up occurring. And that's the last thing that we want to happen as people that work in this industry. So again, I'm not condoning it in any way, but I just want us to think about when these ethical considerations come about and we go through this ethical decision-making model that I'm going to bring up towards the end of the presentation, how can we be proactive in helping to provide caregivers with resources and supports so that hopefully we don't get to this point of abuse and neglect. And when we think about neglect, again, we have the physical, emotional, we have abandonment, we have financial neglect. I think we, again, talk about some of these quite often, but one we don't talk about, I think, enough is self-neglect. And this happens when an older adult fails to meet their own essential physical, psychological, and social needs. And it really then starts to threaten their health, safety, and well-being. And this could include things like not getting an adequate amount of food, not having proper clothing or shelter or health care for their own needs. And for some, this might be a personal choice to self-neglect. They might, be kind of in a maybe failure to thrive situation, but some might be the result of financial inability or physical inability to meet their own needs. So, again, this might be something that you're seeing in your various professions, this self neglect. And it can be really, really hard sometimes to motivate an older adult to um, kind of come out of this self neglect, or can be challenging to get the right resources in place to help the individual um, get all of their needs met from the physical, psychological, and social aspects. So, as professions in this field, I think it's important that we understand um, when to report. Again, many of us are mandatory reporters, and when we've been going through our training and our schooling, we've been taught when that this is appropriate. And so this checklist comes from the National Adult Protective Service Association. You can, of course, report abuse or neglect by calling 911 or contacting your local adult protective service organization. And I'm not going to read it word for word, but this can be good to keep on hand to share with family caregivers, maybe from an educational standpoint, again, so that we can be proactive in hopefully preventing these things from occurring in the first place. Also, some additional tips on elder abuse prevention. We know that World Elder Abuse Day is June 15th, so that's coming up in a few months. So perhaps in your organization you want to bring up this topic of ethics on that day, June 15th, and you can go, there's a whole website on World Elder Abuse Awareness Day where they have great resources. But we can again work to reduce the risk of abuse and that ethical principle of doing no harm, preventing harm from happening by taking some of these preventative measures. Of course, being aware of the risks that abuse or neglect, that the risks that make an older adult more vulnerable again to abuse or neglect, learning the signs, and preventing isolation. Making sure older adults have regular interactions, people are checking in on them regularly, providing respite breaks for caregivers so that they don't reach that point of burnout or overwhelming feelings, that they can have time to kind of refresh, recharge their batteries, and come back ready to continue caring. In the area of advanced planning, I saw that come up a lot in the comments that you all shared today. If we can encourage having those plans in place, especially for finance and healthcare, that can go a long way in helping to prevent some of this abuse or neglect, or minimize ethical considerations when you have, in place your power of attorney for health and finance and those advanced directives. Also, educating on fraud. I haven't really touched on that type of elder abuse very much, but we are seeing more and more fraud taking place and targeting the older adult population. So, being proactive, understanding the signs that fraud might be going on, and then, of course, reporting abuse will hopefully help to prevent it going forward. And then, as I stated earlier, raising awareness, using days like Elder Abuse Awareness Day to educate on this topic. And as I mentioned, a lot of what you have typed in the chat really centers around this ethical dilemma of support of an older adult's care decisions. And often we see this, happening at end of life, the ethical principle of autonomy, allowing them to participate in their decision making, that can come up often. So it's really, of course, important for us as professionals, but also for family caregivers to ask an older adult about their preferences, their choices, and really listen and try to respect those, especially in these areas that we often see some ethical dilemmas arising, like ongoing care or discontinuing of treatment. A person might decide not to pursue cancer treatment, and that might be really hard for family members to understand and respect. They might try to push for the treatment when the older adult's saying, no, I'm tired, I don't want to go through all the side effects. When we put together those advanced directives, a lot of times we're outlining our life-sustaining interventions that we do or do not want. And then when it comes time for an older, or sorry, a caregiver to make a decision about some of those life-saving interventions if there is no advance directive. It can be an ethical dilemma for that family member. Do I keep them on this life-sustaining intervention? Do I get a second opinion? Those types of things. And so, again, that's why those advance directives can be so important. The same goes for the do not resuscitate orders. And again, those end of life decisions. And one that came up recently in a presentation that I did on this topic was participation in research, and wanting to donate a body to science. A lot of times that can create an ethical dilemma or a conflict with the family. They know they don't want the body to be donated to science, but the older adult says, yes, yes, I want that. I want that to be part of the legacy that I live or that I leave behind. So those are some really tough topics that are hard to navigate when we talk about these supported care decisions. And then there's this term, dignity of risk. I don't know if you've heard it, but it's the right to take a reasonable risk but still allow the person to have dignity and self-esteem. And this is really hard because it balances autonomy, beneficence, and non-maleficence. We want to give the older adult the autonomy to make their own decisions, but we want to do what's best for them and keep them safe. We, want to be proactive. We want to do no harm. And this is especially hard for the very cautious caregiver who's concerned about their duty of care. I see this a lot in the area of fall risk. There might be a parent who is at a risk of falls, but they refuse to have help into the home. They refuse to move. But the adult children feel like they are at their wits' end. They've tried everything, and now they're left thinking, well, do we just let them fall and see if that finally gets them to make the move or to get the help? And that is the last thing we want. We don't want that kind of a situation to happen. So can we help family caregivers kind of go through an exercise of evaluating the risk? And can we find some dignity of risk? Maybe there's a middle ground that we can help the older adult in the family come to. Maybe it's adding some home safety equipment into the home to reduce the risk of falls. Or maybe it is convincing them to try some in-home care for maybe it's 30 days or 60 days to see if that can help support them in their day-to-day and reduce that risk of falls. But that's really hard because, again, we want to protect a person's independence. No one likes that being taken from them. But they might be at risk for a variety of things. And so it's really important to have those conversations and to talk with the older adult to understand their concerns and their wishes, and then hopefully come to a mutual place of decision and understanding. And then on this next slide, we've talked a little bit about Alzheimer's, dementia, cognitive impairment, but it's important to remember just because someone has a diagnosis doesn't mean that they all of a sudden lack thoughts and feelings and desires and lack their ability to contribute in meaningful ways. We really need to support those living with dementia and help find that balance of autonomy and beneficence. We want to do good for that person, but we also want to help them be as independent for as long as possible. As the disease progresses, as I mentioned earlier, they might not have the capacity to make decisions or informed choices. But we do need to make sure that we are allowing the person to do as much as they can for themselves for as long as they can. We don't want to ignore those areas where they're still capable. We want to involve them in care decisions, consult them, even if they can't make the decision alone. Let their voice be heard. This helps to promote that dignity and respect. And it is important to evaluate in these instances if the person has capacity, especially as the disease progresses. This is something we might have to come back to every couple of months or maybe every week, depending again on where they are in the disease process and the decline. But it's important to evaluate, and you can ask yourself some questions. Can they make a reasonable and informed decision? Will it cause harm to themselves or others? Gosh, that question comes up a lot in the topic of driving safety. Can someone with dementia still drive safely? Well, maybe at the very early stages of their disease, yes, but as it progresses, no. Another question to ask is, can the person understand the risks and the benefits? That's really important. And then, is there consistency across time? So, for example, has mom or dad always expressed the desire to remain at home? Or have they expressed to multiple people that they do not want to be placed on life support? That would be an example of things that they've expressed consistently over time. And maybe that can help guide some of that decision making if they're no longer able to contribute. But it is, again, important to allow a person to do what they're capable of for as long as possible. And it can be really easy for family caregivers to want to take over and do things for them. Maybe it's faster or easier that way. But again, if we help them to see it from that person's perspective and their independence and their dignity and their respect, maybe that can help family caregivers start to kind of change their perspective. Maybe it allows them a little more patience in doing certain activities. And oftentimes, I see families faced with an ethical dilemma when trying to decide if they put their loved one in a facility, a community, or move them to a new environment. That can be really, really hard. It can weigh on a lot of family members. And so, again, we need to help those families kind of go through an exercise of weighing the risks and the benefits. Find that balance of autonomy and beneficence. And so, again, there's a lot of ethical considerations when working with the population of individuals living with dementia and Alzheimer's disease and other types of neurocognitive disorders. But as promised, I have this ethical decision-making model that can hopefully help everyone walk through some of these decisions and ultimately kind of get to that decision to do the right thing, do what's best. So this model was developed by Dr. Crocker. She's out of the University of Creighton, and she is very well known for her ethics work and work in the field of ethics. And so I really like her decision-making model. First, it has you understand the dilemma. What is the ethical issue at hand? What are the conflicting values that we are experiencing? What are also the facts? Sometimes in these ethical decisions, we can let emotions get the best of us, especially for family caregivers. So sometimes it's important to ground ourselves in the facts. Also evaluate what stakeholders are being impacted here by this situation. So then once you have a good picture of the dilemma at hand, then we can imagine the options. At first glance, what are the black and white obvious solutions? But then on second thought, what are some of the out-of-the-box solutions? What are some things we haven't thought about? Is there a new approach that we can take? And I like how she says, step 3, when you think through the options, think far, think wide, and think high. So think far, what's in it for me? Which options produce the greatest good for everyone concerned? In the situation. Think wide. What do legal, professional, organizational, human rights responsibilities? What does that require? What is fair? And then to think high. What are the aspirations of the people and organizations involved? And which options would people you respect be proud of? Are there any that would be embarrassing? That can be a really good gut check. Would I be proud to tell another person, to tell a colleague, how I handled this situation? And then decide what is the right thing to do and why. So again, this can be helpful as you go through this decision-making process. There's another ethical decision-making model that I also want to share. This is developed by Foster and Miller. It's very similar to Dr. Crocker's model, but in step 6, It has you evaluate the course of action with these kind of three simple tests that I think can also be helpful. So look at it through the lens of justice, publicity, and universality. So for justice, apply the test of justice. Assess your own sense of fairness by determining whether you would treat others the same in the situation. Then, from a publicity standpoint, it's kind of that gut check again. Would you be okay with your behavior or decision being reported in the press? And then, universality. Test to assess or ask yourself, could you recommend the same course of action to another person in the same situation? So, again, these can be really helpful in walking through these ethical decisions. And then I want to wrap up with just a few tips for some professionals and tips for caregivers. So, of course, as we think about ethics, we want to inquire about our own organization's ethical practices. We also want to review our code of ethics specific to our professions. We also, if there is a client bill of rights, make sure that we are in the know about those, that we keep up to date on any changes. Also, when it comes to national and local laws and regulations for your profession or industry, of course, we want to stay on top of those. And then engage in these ethical decision making models. Utilize them in your kind of ethical dilemmas. Sometimes I know we have to act fast and we might not have time to sit down and write out our answers to all of these, but you can kind of do just a quick check, a quick assessment in your mind if you're pressed for time. And then report any abuse or neglect, of course. That is an important part, again, of our duty to care well for those that we serve. And then for family caregivers, help them to learn the signs of abuse and neglect. Educate them on things like fraud prevention. And then encourage that planning ahead and the discussion of their wishes. Consider their everyday and their long-term needs. And of course, get those important documents in place, those advance directives, those power of attorney for health and finance. And then also encourage them to seek professional help when it's needed. Elder law attorneys can be a great resource. So can geriatric case managers. Again, helping families plan ahead, get the important documents in place so that the person's wishes can be carried out to the best of everyone's abilities. And the great news is when we get it right, it really does make all the difference. We cannot avoid every ethical issue, but we can equip ourselves. We can equip the family caregivers that we work with. We can provide them with tools and resources to enhance quality of life. Because again, when we get it right, it really does make all the difference. We can support autonomy and decision making in the older adults that we serve. We can seek justice for the elders in our care and oversight, and we can do good on behalf of the individual and aim to protect their safety and aim to cause no harm. And we can show our loyalty and faithfulness and honor our commitments to their care when we prioritize ethics. So again, these ethical concepts help us to be better service providers, better healthcare workers, better family members, and better friends. And so again, you don't have to have all the terms down. You don't have to have them memorized, but we can incorporate the meaning behind them into our daily practices as we serve older adults and caregivers that we work with. And then I wanted to leave you with some resources. Of course, there's the National Center on Elder Abuse. USC has a great website. Again, they provide a lot of those resources for World Elder Abuse Awareness Day. Adult Protective Services, I've talked about that, and the Ombudsman Program, they have their respective websites. Also, the AAAs, Area Agencies on Aging, we know that they can be a great resource for families. And of course, you can find one nearest to you at eldercare.gov. And then there's the Business Ethics Alliance, and Dr. Crocker, she helped to found that. They have a whole website. It is very business focused, not necessarily focused on older adults, but uh, it does have some helpful resources. And then Canada has a Center for Ethics and Corporate Policy that is very similar in the resources that they provide. And then, of course, the elder law attorney um, organization can be a great place to find a local elder law attorney nearest the person that you're working with. So hopefully these resources can be helpful. And now I'm going to open it up for some questions. I know, again, I want to thank you all for typing in your ethical dilemmas that you're facing. Again, I see a lot of advanced directives, a lot related to dementia and boundaries. That again can be a really tough ethical dilemma. Um, I know, again, there's just so many ethical dilemmas that come up in our day to day roles. And so that's where, I can't address all of them today, but that's where those ethical decision making models can really be helpful in helping you go through these um, specific situations that you're facing. So, Julia, did you see any kind of themes in the questions that were coming in, or any questions that really stand out to you?
Absolutely. I think one of the things that I've noticed is that advanced directives and how, first, when can you, where is that boundary as to when is someone not able to sign an advanced directive? As I'm
Yeah,
assuming that person was inquiring about a dementia diagnosis or something related where they may not, the question of capacity might come in.
yeah.
And then also how to enforce advanced directives with people that have been appointed, but still may not be following them, which is a unique situation.
Yeah, I think that the topic of competency and capacity when it relates to dementia, it is really tough. And sometimes that's when you need to get professionals involved in the situation, like an attorney or a healthcare provider. Um, and those questions that I had referenced on that slide, can they make a reasonable, informed decision? Will it cause harm to themselves and others? Understanding the risks and benefits. Has there been consistency across time? Those kinds of questions could help you in the moment. But I can also understand, from a provider perspective, you have to weigh the risks and the liability on your side of things. And so that's why sometimes it can be beneficial to get a legal professional involved so that you are able to kind of get that professional guidance. And then, when it comes to those advanced directives, making sure that everyone involved in the care that needs to know about the advanced directives, making sure they have a copy or the most up to date. I think something else that's important to note is to revisit those advanced directives, especially after a significant event in the family, perhaps the death of a relative or loved one. Oftentimes I see, the spouse passes away and they were the one that was the power of attorney, or they were the ones that were designated in some of those advanced directives. Well, now they're no longer living, but those documents never got updated, and now the family's in crisis mode, and it just really opens up a whole new can of worms. So it's really important to encourage families to revisit those regularly to make sure that they are still up to date, and then making sure your hospital system has it, your healthcare provider has those. I know I had a client. She had a do not resuscitate order that she taped to her kitchen cabinets because she wanted anyone that walked into her apartment to know she had a do not resuscitate order. And so, it's really important to understand what's most important to that individual and again, make their wishes known to everyone that's involved in their caregiving dynamic. So, again, it's a tough one. It's a really, really tough one. And that's why planning ahead as much as possible is so, so important.
Absolutely. And there's just so many questions in the chat box that there's no way we're going to be able to get to them all today, but we do have to close out. We want to thank everyone for being here today, and thank you to Home Instead for bringing this webinar to this audience. As a reminder, you will be able to access the CE application a minimum of 2 hours after viewing the event, although it may take a little bit longer because we had a large audience today. If you registered before the live webinar date, you will also receive a follow-up email by the end of the business day today that will direct you on how to claim CEs and include the links to today's slides and the recording. If you have any questions about the webinar, please feel free to email ASA at info@asaging.org. You can also go to our website to see the upcoming webinars, including Aging in Place, Home Safety and Fall Prevention, which will be held on April 3rd. And you can find information about that webinar at www.asaging.org. If you would like to share today's presentation with anyone, the CEs are available for a full 60 days. Thank you again to Lakeland and Homestead. We really enjoyed this presentation and all the information that you shared. And we hope that you will join ASA for another webinar soon. Have a lovely rest of your day.